allergies, PMS, your immune system goes downward. Because remember, 80% of your immune is in your bowel, and if it's overloaded with yeast, then that means the good bacteria aren't in there to help produce or replicate. They're overwhelmed actually by the yeast, and so then your immune system goes down, your ability to manufacture serotonin goes down, your ability to break down your nutrients. So we see things with hypoglycemia, blood sugar disruptions, and I believe it can be a major contributing factor to hypoglycemia and to diabetes. There's some studies on that, and we had addressed it before that a lot of alcoholics, a good percentage of them, over 90%, were or are hypoglycemic. They have blood sugar issues. Athletes' feet will typically see it, itchy, scratchy, and it's difficult to catch athletes' feet if your body is in good immune system running order. So if you're in the shower and everybody's showering off in the locker room, you're not going to catch the yeast if you don't have a susceptibility or your immune system is there. It's not going to happen. Thrush, that's in the mouth. Real common in babies particularly, and what that means is they don't have enough good bacteria in their body, and they get this white filmy looking stuff on their mouth. It's kind of itchy, it burns. Once again, only in the mouth versus vaginal cavity. It can, over the long haul, cause inflammatory of the bowel, eczema, a lot of skin conditions. It can make you hypersensitive to everything. So, first line of defense, if you've got a lot of these things going on in conjunction, you might want to contemplate getting rid of the yeast and doing some diet modifications, as we're going to discuss further on. Causes, as we discuss, antibiotics, corticosteroids. If a person is doing corticosteroids, particularly those nice little Flonase and other things in their nasal passages, I've seen systemic yeast develop as a result of those. They cause the immune system or the body's ability to replicate good bacteria to dive. Birth control usage. Yeah, people don't think about that. That raises it up. There's a lot of medications such as nystatins and other meds, fluoride, other things, chlorine. They all destroy the good bacteria that can allow for yeast overgrowth. Consumption of refined carbohydrates or excessive amount of fruit juice drinking. A lot of people think they're doing their body really good by drinking those big old glasses of juice throughout the day. But I have to tell you, a little bit of juice is fine if you're not diabetic, but it definitely feeds yeast because it's pure sugar. Eating the wholesome good fruit with the fibers and the skins and things like that that are on fruit, much better alternative. Improper hygiene can cause systemic yeast to occur. Unlike most people who have the belief that it can be transferred sexually between partners, most of the research that I came across says, no, it cannot. So if your immune system's good, it isn't going to be sexually transmitted between partners. If your immune system is poor, possibly could be. There's other IgA or immune system deficiencies that can occur in the body that can allow yeast to take over. So the yeast can kind of cause it, or it can be caused by immune system issues because your body can't identify friend from foes. Allergy, chemical exposures. Once again, I was talking about the fluorides, especially the type of fluoride that's found in our water that's a toxic chemical. Chlorine, which we have and we can smell throughout our water unless you have a water filter. And then allergies in combination with that corticosteroids can make very, very yeast receptive. Because remember, allergies are chronically causing your immune system to always be in heightened order and taxing the immune system. But once again, yeast can cause allergies, allergies can cause